When we talked about agonist dose response curves, we talked about the concentration of drug required to achieve half of the maximum expected response. The EC50 is the concentration of drug required to achieve half of the maximum expected response. But you'll look in other books and they'll use dose, and dose is just the amount of medication given. And the ED50 is quite simply the dose of the drug required to achieve half of the expected response. Please do not confuse any of that with the TD50. The TD50 is the dose of the drug required to achieve toxicity in half of the subjects given the drug. If somebody came to the emergency room and had overdosed on a medication, and if they've taken a dose of the drug that is equivalent to the TD50, then they have a 50% chance of having toxicity with that overdose. The LD50 is the dose of the drug required to be lethal in half of the subjects given the drug. And we usually describe this as dose of the drug per kilogram of the recipient. So if the person who has come to the emergency room with an overdose has taken the LD50 of the drug, then they have a 50% chance of having a lethal outcome from that dose if we do not intervene. The T1/2, or half-life, is the amount of time required to lower the concentration of the drug by half. This represents the amount of drug in the body given at time 0. So when we give a drug, this is the amount of drug in the body. After the first half-life, half of the drug has been eliminated. After one half-life, the amount of drug in the body is half. Well, after 2 half-lives, the amount of drug in the body is half of that half, or 1/4, meaning 3/4 of the drug have been eliminated after the second half-life. After 3 half-lives, the amount of drug in the body is half of the half of the half, meaning 1/8, meaning 7/8 of the drug have been eliminated. After 4 half-lives, the amount of drug in the body is 1/16. Half of a half of a half of a half is 1/16. So after 5 or 6 half-lives, the drug is considered to be eliminated.